Hi everybody, my name is Elizabeth Hughes. Thanks for joining me again. In my last two videos, I spoke very specifically about what chronic exposure to the main fight or flight, the main stress hormones, can do to you. Those two main stress hormones, epinephrine and cortisol. I want to put this into some practical terms because I was talking a little bit theoretically last time, and I want to talk about some conditions that are very specifically worsened by long-term physiologic stress. And I'm just going to list a few things that are medical conditions, and you tell me if you notice any of these conditions as something that you are wrestling with. So just listen to what I'm going to talk about right now. Let's talk about intestinal conditions like irritable bowel syndrome, food intolerances, reflux, bad heartburn, hormonal problems like thyroid disorders, infertility problems, problems with your period or missed periods, metabolic problems like diabetes, immune problems like chronic infections, overgrowth of bacteria where they shouldn't be, overgrowth of yeast where they shouldn't be, immune dysfunction like autoimmune conditions or cancers, heart problems, high blood pressure, problems with heart palpitations, anxiety, depression, insomnia, memory problems like lack of clarity, like you can't think, or you have what so many people have, brain fog. Just you can't even put two and two together because your brain just doesn't seem to be clinking into place the way it's supposed to. Muscle weakness, loss of muscle, muscle mass, atrophy, skin or hair changes, really dry skin, hair falling out, all of those things, my skin and hair just not being what they should be, oily in some areas, very dry in other areas, acne is something that can be caused by cortisol, and poor wound healing, whether no matter what type of wound it is. So those are some things that a few of the conditions that can be directly attributed to having high levels of either cortisol or epinephrine. Or if you have those things for other reasons, having high levels of epinephrine or cortisol aren't helping you heal them either. They can definitely be made worse. If you have any questions or have any additions to this list, hey, list them below, please. I'd love comments. And you can learn more about me and what I do at my website, www.elizabethhughesmd.com. Thanks for watching. Bye.